there are nearly 800,000 adults living with end-stage renal disease in the US today. This disease affects both men and women, and it is seen in higher rates among minorities. My name is Lupita Rodriguez. I'm a certified dialysis nurse, and today I will discuss with you what end-stage renal disease, what it is, what causes this, and what treatment options are available for patients who suffer from this. First of all, what are the functions of the kidneys? Well, the kidneys filter the blood, removing toxins and fluid in the form of urine. They also help to balance electrolytes in the body. They assist with hormone production to help stabilize our blood pressure, help maintain our red blood cell production, and help keep our bones strong and healthy. So there are 5 stages in chronic kidney disease. Stage 1, the kidneys are working fine, patients are feeling healthy, all the way down to stage 5, where the kidneys are not working at optimal level anymore, and the patients are not feeling very well. So end-stage renal disease is the 5th and final stage of chronic kidney disease. The National Institute of Diabetes, Digestive, and Kidney Diseases state that ESRD is the point at which kidneys function at 15% or less. You may be wondering how the stage is determined. Well, it is determined through blood work done at your physician's office. They will draw blood either on an annual visit, or if a patient is not feeling well based on symptoms, they'll draw blood and they will draw labs that are pertinent to kidney function, a creatinine and a BUN. Based on the results, they will calculate the patient's estimated glomerular filtration rate, and that will tell you what stage of chronic kidney disease you fall under. Okay, for end-stage renal disease, now that we know this is stage 5, the final stage, at this stage, patients may experience symptoms such as loss of appetite, nausea, metallic taste in the mouth, weakness, shortness of breath, a lot of swelling because they're not able to urinate, and very, very little urine production. So what causes end-stage renal disease? Well, diabetes, high blood pressure are the 2 main causes. There are other causes as well. The use of IV contrast dyes. When we go in for procedures, sometimes they need to use IV contrast, and this is very, very hard for the kidneys to process. Also, sometimes malformation in utero. There could be kidney blockages such as pelvic tumors, bladder cancer, frequent urinary tract infections, and cervical cancer. Once a patient hits a percentage of kidney function of 15% or less, it is time to start thinking of renal replacement therapy. We need something that is going to do the job of the kidneys for these patients. Otherwise, they're not going to feel well. Luckily, we have 3 options. There's hemodialysis, which involves a machine in a facility where the patient will come in and they will put 2 needles in the patient's arm. 1 needle will pull the blood out of the body, run it through a filter called a dialyzer, also working as a kidney, and the other needle will send the blood right back to the patient. And this will go on for about 3 to 4 hours. They do have to do this indefinitely, and they go about 3 times a week. Another option is called peritoneal dialysis. This type of dialysis is done through a catheter in the belly. This type of modality is really nice because they can do this one at home, they can do this while they sleep, they can go on vacation and do this, and there are no needles involved in this. The third type of treatment is called a transplant. Transplant is also called the gold standard according to the National Kidney Foundation. A transplant can be done using a live donor, somebody who's willing to go get the workup done, make sure, see if they're a match, and then if they're a match, they'll have surgery. They will take one kidney from that live donor and place it in the patient. You only need one kidney for transplant, or you can get a kidney from a cadaver. Cadaver is somebody who has opted to be a organ donor in the event of something happening to them. They have chosen to give their organs to people who are already on transplant lists waiting for organs. So those are the 3 treatment options. So in closing, one now understands what ESRD is, what the causes are, and what life-sustaining treatments are available. ESRD is the final stage of CKD to which there is no cure, but there are 3 options that can help patients live long, productive lives. Overall, chronic kidney disease affects nearly 800,000 adults. There are no limitations of who is at risk. In the end, everyone should be proactive in their health to prevent or manage any conditions that can lead to end-stage renal disease. Thank you.